You feel pressure building in your chest after eating a meal. Perhaps you blame the pizza, the beans, or that spicy food you just finished. You burp, you shift your position and move around, but the pressure simply does not go away. And here is the genuinely alarming part. What most people dismiss as ordinary gas could actually be their heart's final warning signal before a heart attack. Now, before you begin to panic, let us be completely clear about something. Not all chest discomfort is cardiac in nature. But when your body sends this particular kind of signal, understanding the difference between the two can quite literally save your life. So let us break this down carefully and clearly. When you consume a large and heavy meal, your stomach expands and gas begins accumulating inside it, stretching the stomach walls outward. That stretching sensation activates the vagus nerve, which is one of the longest and most important nerves in your entire body, running from the brain stem at the back of your brain all the way down through your chest and into your gut. This is precisely why you feel that bloated, crampy, or burning sensation right beneath your breastbone. It is deeply uncomfortable, but in most cases it is completely harmless. Now here is where things get genuinely complicated and critically important. The heart sits directly behind the sternum, positioned just above the stomach, and shares overlapping nerve pathways with that same vagus nerve and the thoracic spinal nerves. So when your heart muscle begins losing oxygen, your brain can actually confuse that deep pressure and discomfort for indigestion. If one of your coronary arteries, the vessels responsible for delivering oxygen to the heart muscle, begins narrowing due to plaque buildup in a process we call atherosclerosis, blood flow to the heart drops significantly. The heart cells begin desperately crying out for oxygen. Within minutes, those oxygen-deprived cells switch to anaerobic metabolism, producing lactic acid and inflammatory chemicals that irritate the surrounding nerve endings. Your brain now receives this distressing signal, but because those same nerves also serve the stomach and esophagus, the sensation can feel deceptively similar to acid reflux or trapped gas. And that is precisely why millions of people delay calling for emergency help when they should not. They simply do not recognize what is actually happening. Now let us go even deeper into the physiology, because this is something you truly need to understand. The spinal cord segments that receive distress signals from the heart, specifically the thoracic nerve levels T1 through T5, also receive input from your chest wall, your neck, and your left arm. This is why cardiac pain can radiate and travel into the arm, the jaw, or even the back. It is a well-known phenomenon called referred pain. Your brain simply cannot accurately distinguish which specific tissue the pain signal is truly originating from. Here is a helpful way to visualize this. Imagine a telephone line with 3 separate houses all connected to the same single wire: the heart, the stomach, and the shoulder. When one house sends a distress signal through that wire, the other houses light up and respond as well. That is precisely how your nervous system reacts in this situation. Now let us discuss the specific symptoms you need to watch for. When a coronary artery begins closing and restricting blood flow, your autonomic nervous system shifts into a state of overdrive. The sympathetic nervous system triggers sweating, mounting anxiety, shortness of breath, and that sudden and overwhelming feeling of impending doom. Your blood pressure can spike dramatically. Your breathing quickens and your heart races in a desperate attempt to push more oxygen through those narrowed and compromised arteries. That is your body fighting to survive. And this is why you might simultaneously experience nausea, cold sweats, or dizziness, not because of anything happening in your stomach, but because your brain is responding to a serious and widespread oxygen imbalance throughout your system. And here is another critical reason why so many people miss the warning signs entirely. These warning pains can appear days or even weeks before a full heart attack actually occurs. These episodes are called unstable angina, and they happen when blood flow drops just enough to cause pain and discomfort, but not quite enough to kill heart tissue yet. Each one of these episodes is your body sending out a desperate cry for help, a red flag warning that a much larger and more serious event may be approaching if nothing is done. Now let us make this interactive for a moment. If you ever feel pressure in your chest that does not resolve when you change your body position, move around, or burp, take your index and middle fingers and check your pulse at your wrist. If it feels irregular, racing, or unusually faint, do not second-guess yourself or try to rationalize it away. Sit down immediately, breathe as calmly as you can, and call emergency services right away. And here is how you can more reliably distinguish between likely gas or acid reflux and something more serious, Gas or reflux-type discomfort tends to shift and change with body position. It typically improves when you burp or have a bowel movement. It tends to produce a burning sensation higher up in the chest or in the throat, and it is usually triggered very soon after eating, especially if you are lying down afterward. But if the discomfort feels deep, heavy, spreading, or is accompanied by dizziness, sweating, or nausea, assume the worst until you have been properly evaluated and proven otherwise. Do not take chances with these symptoms. Let us also talk about timing, because it is critically important. The average time that people experiencing a heart attack wait before finally calling for emergency help is over 2 hours. That is far too long. That represents 2 full hours during which heart tissue is actively dying from lack of oxygen. Every single minute matters enormously. Doctors describe this with the phrase, "Time is muscle." And here is what is happening in your heart during that precious lost time. Within 10 minutes, heart cells begin losing their electrical stability. Within 20 to 30 minutes, irreversible cellular injury begins occurring. Within 1 hour, scar tissue starts forming where healthy heart muscle used to be. This information is not intended to frighten you. It is intended to genuinely empower you, because when you understand and recognize these signals clearly, you can act faster, preserve more of your heart muscle, and prevent long-term damage that could affect the rest of your life. So let us close with one powerful and important thought. Your body was designed with extraordinary biological intelligence. It does not send signals and whisper warnings without a meaningful reason. That heaviness, that deep ache, that unusual feeling you cannot quite explain, all of it is communication from your body. The question you have to honestly ask yourself is whether you are truly listening to it. If you have ever brushed off chest discomfort as nothing more than gas, make yourself this promise right now. The next time it happens, stop what you are doing and pay genuine and careful attention to it. It may turn out to be nothing serious, but if it is something, recognizing it and acting on it quickly could be the difference between life and death. Take care of your heart. Know the warning signs, and please share this video with the people you care about, because doing so just might save someone else's life. I truly hope this video proves helpful and valuable to you. And please do not ignore those symptoms, because it is your life we are talking about. Leave your comments below, and most importantly, go out and make it a truly great day. I am Dr. Alan Mandell,